Hello everyone. The topic of my presentation today is on gingiva. The periodontium consists of gingiva, periodontal ligament, cementum, and alveolar bone. The gingiva is that part of the oral mucosa that covers the alveolar processes of the jaws and surrounds the neck of the teeth. Anatomically, gingiva is divided into three parts: the marginal gingiva and gingival sulcus, attached gingiva, and interdental gingiva. Marginal gingiva or the unattached gingiva is the terminal edge or border of the gingiva surrounding the teeth in a collar-like fashion. The gingival sulcus is an area of potential space between a tooth and the surrounding gingival tissue. The attached gingiva is continuous with the marginal gingiva. It is firm, resilient, and tightly bound to the underlying periodontium of the alveolar bone. The facial aspect of attached gingiva extends to the relatively loose and movable alveolar mucosa and is demarcated by the mucogingival junction. As you can see in the picture, the arrow shows the mucogingival junction. The width of the attached gingiva is the distance between mucogingival junction and the projection of the external surface of the bottom of gingival sulcus of the periodontal pocket. The maximum width of attached gingiva can be seen in the incisal area, in maxilla 3.5 to 4.5 mm, and in mandible 3.3 to 3.9 mm. Minimum width is seen in the first premolar area, in maxilla 1.9 mm and in mandible 1.8 mm. The interdental gingiva occupies the gingival embrasure, which is present in the interproximal space. The shape of the interdental gingiva is pyramidal or caul-shaped. Clinical parameters depends on the adjacent contact point. Pathological parameter depends on the presence or absence of gingival recession. In diastema, interdental gingiva depicts as smooth, rounded surface without the interdental papilla. Gingival sulcus is a shallow crevice or space around the tooth bounded by the surface of the tooth on one side and the free margin of gingiva on the other side. It is V-shaped and barely permits the entrance of the periodontal probe. Clinical depth of gingival sulcus is 2.3 mm, whereas the histological depth is 1.8 mm. The gingival sulcus extends from the gingival margin apically to the cemento-enamel junction. It forms a seal against the tooth and acts as a barrier to subgingival plaque, bacteria, and prevents fluid loss from the underlying connective tissue. Coming to the clinical features of gingiva, the clinical features include color, size, contour, consistency, shape, and surface texture. The color of the attached or marginal gingiva is generally described as coral pink and is produced by factors like the vascular blood supply, the thickness and degree of keratinization of the epithelium, and presence of pigment containing cells. Size is the total sum of the bulk of the cellular and intercellular elements and their vascular supply. Alteration in the size is a common feature of gingival disease. Contour depends on the shape of the teeth and their alignment in the arch, the location and size of the area of the proximal contact, and the dimensions of the facial and the lingual gingival embrasures. Consistency of gingiva is firm and resilient, and with the exception of the freely movable gingival margin, which is tightly bound to the underlying bone. Shape of the gingiva depends on the contour of the proximal tooth surface and location and shape of the gingival embrasure. Surface texture, the gingiva presents a textured surface like that of an orange peel and is referred to as being stippled. Stippling is best viewed by drying of the gingiva. The attached gingiva is stippled and marginal gingiva is not. Microscopic features of gingiva. Microscopic examination reveals that gingiva is composed of overlying stratified squamous epithelium and the underlying central core of the connective tissue. The epithelium is predominantly cellular and the connective tissue is less cellular and composed of collagen fibers. Gingival epithelium acts as a physical barrier to infection and underlying gingival attachment. Plays an active role in innate defense by responding to bacteria in an interactive manner. The principal cell type of gingival epithelium is keratinocyte. Gingival epithelium contains other cells which are clear cells or non-keratinocytes, which include the Langerhans cells, Merkel cells and melanocytes. Main function of gingiva is to protect the deep structures while allowing a selective interchange with the oral environment. This is achieved by proliferation and differentiation of keratinocytes. In the picture you can see the various layers of stratified squamous epithelium. The basal layer is known as stratum basale. Then there's a stratum corneum. Then on top of that you can see stratum granulosum, and the topmost layer is known as stratum corneum. The gingival epithelium, depending on these layers, they are subdivided into three sections: the oral epithelium, sulcular epithelium and the junctional epithelium. Outer or oral epithelium covers the crest of the outer surface of marginal gingiva and the surface of attached gingiva. The thickness of this epithelium is 0.2 to 0.3 mm. It is keratinized or parakeratinized. The layers present in oral epithelium are stratum basale, stratum spinosum, stratum granulosum and stratum corneum. Keratinization diminishes with age and with onset of menopause. Keratinization of oral mucosa varies in different areas in the following orders. Maximum keratinization is in palate, then in gingiva, then ventral aspect of the tongue and then cheek. Sulcular epithelium is a stratified squamous epithelium. It is non-keratinized or parakeratinized, that is continuous with the oral epithelium and lines the lateral surface of the sulcus. The junction between the epithelium and the connective tissue is straight without any retipeg formation. It is potential to keratinization if it is reflected and exposed to the oral cavity, and if bacterial flora from the sulcus is exposed, then the sulcular epithelium can be converted into keratinized epithelium. Acts as a semi-permeable membrane through which injurious bacterial products pass into the tissues, and tissue fluids from gingiva seeps into the sulcus. Junctional epithelium is a stratified non-keratinizing epithelium that surrounds the tooth like a collar with a cross section resembling a thin wedge. It is 3 to 4 mm thick in early life. With age, the layers increases. It can reach up to 10 to 20 layers of thickness. There are two strata, the basal layer facing the connective tissue and the subbasal layer extending into the tooth surface. The length of the junctional epithelium is 0.25 mm to 1.35 mm. Coming to the gingival connective tissue, the major components of the connective tissue are collagen fibers, which constitute about 60% of the connective tissue. Then fibroblasts, which constitute the around 5% of the gingival connective tissue. Vessels and nerves, which make up to 35% of the gingival connective tissue, which are embedded in an amorphous ground substance known as the matrix. So these are the types of gingival fibers. The dentogingival fibers insert into the supracrestal root cementum and fan out into the adjacent connective tissue. The dento-periosteal fibers insert into the supracrestal root cementum and blend with the periosteal covering of the adjacent alveolar process. The alveolar gingival fibers insert into the alveolar crest and fan out into the adjacent gingival connective tissue. The circumferential fibers follow a circular course around the individual dental unit. You can see the fibers in the pictures. The semicircular fibers insert on the proximal surface of a tooth and follow a semicircular course to insert on the opposite side of the same tooth. Whereas the transgingival fibers insert into the proximal surface of a tooth and fan out towards the oral or vestibular surface. The interdental gingival course along the oral or vestibular surface of the dental arch. The transeptal fibers course from one proximal surface to the proximal surface of the adjacent tooth. Most of the fibers are composed of collagen with minor contribution from elastic fibers and oxytocin fibers. Coming to gingival vessels and nerves, the gingiva is basically supplied from three main sources of blood supply. The supraperiosteal arteriole, vessels of the periodontal ligament, and arterioles. Nerve supply of gingiva, the maxillary arch, the gingiva is supplied by the nasopalatine nerve, posterior superior alveolar nerve, greater palatine nerve, and anterior palatine nerve, whereas the mandibular gingiva is supplied by the inferior alveolar nerve. Coming to the conclusion, gingival tissue plays a key role in the protection of the tooth surfaces and supporting periodontal tissues against trauma or infection. Maintaining the gingiva health is very essential component for the success of all periodontal treatment procedures. Therefore, gingiva, a small tissue, is a big issue for the fraternity of periodontics. Thank you.